So the latest information that we have for you in Foxboro is that the cases in Foxboro have not changed. That's good news. We're at 15 cases, 15 positive cases. Actually, we've had 22 cases overall determined to be positive. 7 cases have recovered. I understand that 2 more cases may recover as of tomorrow or later today. So we will then be down to about 13 if the number stands firm in terms of new cases here in Foxboro. Overall, in terms of Massachusetts and the surrounding state and the communities around us and the county around us, there are 12,500 cases currently in Massachusetts, resulting in 231 deaths. In Norfolk County alone, there are 1,271 cases of COVID-19 positive cases as of right now. Wanted to report that we do think that this will be one of the more tougher weeks. That's all the information we've received nationally as well as statewide. This will be one of the more difficult weeks in terms of new cases and what's going on around us. So we will have to take a hard look at that, and we want to make sure that when people go out, that they properly cover themselves and come up with their own type of mask. Not necessarily an N95 mask, but the CDC is actually providing some guidance on that, which I'll report to you shortly. So health professionals can sign up for volunteer opportunities in the communities to help support COVID-19 response at mass.gov/COVID-PXLJ. That's mass.gov/COVID-PXLJ, and that's to help for volunteer opportunities. Governor Baker spoke yesterday from Foxboro. He and Lieutenant Governor Polito discussed the testing facility that was just established at Lot 50 across from the Gillette Stadium to test first responders for COVID-19. They actually will be looking to do about 200 cases per day. It has a capacity to do 200 cases per day, excuse me. And actually that testing will be by appointment only and free to all first responders. At some point, that testing capacity may grow, but at this point in time, it's for first responders only at this point in time. The governor also shared that 100 ventilators have arrived on Saturday from the national stockpile. We are expecting about 900 more to come, which will help reinforce our capacity statewide for ventilators. I believe there's a need for about 1,200 ventilators at this point in time. If we can actually get those additional 1,000 in, 900 in rather, that should help us in the situation, help to bolster that situation quite significantly. We are in a critical time in Massachusetts COVID-19 response. As you may know, on Saturday, the Centers for Disease Control issued a recommendation that all U.S. residents wear cloth masks to prevent the spread of COVID-19 and help flatten the curve. This comes at an important time as we expected to enter the surge period starting on April 7th. Everyone should wear a mask because research now shows that up to 25% of the population may be infected with COVID-19 without symptoms unknowingly in spreading the virus. There are many examples of cloth masks online, some of which are easy to make. Medical grade masks should be reserved for first responders only. After 3 weeks of social distancing, we need to continue to support each other as we stay vigilant with protective measures. Visual reminders are helpful, and with the help of the 26.2 Foundation and Hopkinton High School student Emily Kopp, many statues around Hopkinton, including the George V. Brown statue on the Common, are sporting masks. So if you do need reminders, they're actually out there. But I think by now pretty much everyone knows that we should be doing what we need to do and trying to stay vigilant about not keeping social distancing and keeping our distance so we can protect each and every one of us. These are the latest information that came out from yesterday. Below is a summary of the most recent efforts to respond to the wide range of needs in our communities. Coronavirus testing, there are 12,500 confirmed positive cases with 1,145 hospitalizations and 231 deaths as of yesterday at 4 o'clock. Now, that's about 9.2% of the amount of cases that are being hospitalized at this point in time. Nearly 72,000 tests have been conducted by the state public health laboratories and private testing facilities. The Centers for Disease Control is now recommending that everyone wear a cloth mask, as I mentioned earlier. Um, the Battelle 95 N95 decontamination system, which can sterilize masks for reuse and mitigate severe shortages of protective masks for healthcare providers, has arrived in Somerville and is scheduled to be operational by today. Mentioned that the 100 ventilators have been delivered and 900 more are expected by the end of this week. A drive-through testing facility has been set up at Foxboro and two more sites are being considered for other regions in the Commonwealth. I know the Merrimack Valley is being looked at, and Springfield right now is being looked at. I think Springfield will probably be the next site that will be opened for first responders so they can get tested and get folks back to work as soon as possible. 500 people have volunteered to help UMass Memorial Healthcare run a field hospital at Worcester's DCU Center. The field medical centers are planned for the Boston Convention Center, Exhibition Center, and the Boston Convention and Exhibition Center, and the Joint Base Cape Cod, and another may be considered for Western Massachusetts as well. There is an urgent need for blood donations. Those who are healthy, feeling well, and eligible to give blood or platelets are urged to make an appointment to donate as soon as possible by visiting redcrossblood.org or by calling 1-800-RED-CROSS. That's 1-800-733-2767 if you want to donate blood. Now, just so everyone is comfortable to know that there has been no indication that donating blood has resulted in transferring blood from one person to the next has been an impact in terms of the COVID-19 virus. So there's no impact that way. And I'm sure, quite certain, that the American Red Cross will do everything it can to make sure that you are safe while that donation is being done. The Federal CARES Act, under small business, the Federal CARES Act loan program for small business became available through many local banks on Friday. There has already been an overwhelming number of applications submitted. We are aware that there has been some problems with the process, though it has been raised that local concerns with the federal legislative delegation and as the newsletter from the MRC continues to come out, we'll continue to keep you posted on that front. On the legislative action side, the Joint Committee on Public Safety and Homeland Security is inviting written testimony on legislation that would create a category of hazard duty time for public safety officers and other first responders impacted by COVID-19. The legislation can be reviewed online, and information can also submitting testimony can be done online as well. And that's the only way that the testimony is being given is by email only. Other notices: the Department of Public Health is hiring up to 1,000 people to do contact tracing. Applicants should be fluent with technology, and multilingual applicants are encouraged to apply. You can volunteer for the new Community Tracing Collaborative by visiting the mass.gov or mass.gov site, COVID-19 testing site. And the City of Boston announced that all residents should stay home between 9 p.m. and 6 a.m. That's a first in Massachusetts. Is more or less a quarantine period, so that from 9 p.m. to 6 a.m. The streets are to stay closed for the time being, given the circumstances. And the Massachusetts bar exam, originally scheduled for July, has been postponed to September 30th and October 1st, 2020. So those are the latest updates in and around the Commonwealth. Some of these things do, of course, impact Foxboro. Just on a local note, the COVID-19 website, the Foxboro.ma.gov site, on the Board of Health website, actually provides some additional resources relative to folks who could use help on a whole host of different topics, including housing and stress levels. I know that given the fact that we've all been impacted by the virus in one way, shape, or form, either by restricting our ability to travel from one place to the next, or going to stores, going out, and just going out to have dinner or to go to a local bar. None of us can do that. and just going out to the parks and being able to use the equipment. There's a lot of restriction on all of us right now, so that's causing some undue stress to folks. And so there is some help offered through the website, through the foxboroMA.gov website, on the COVID-19 website subsection of the website. So you might want to check those out to see if you need any particular help as well, feeling the stress of the current environment. As far as one other thing I wanted to mention to you is that folks who are in significant need of toilet paper, there is going to be some free toilet paper distributed by tomorrow at the senior center from 2:30 to 3:30. We're looking at that as a period of time when toilet paper can be distributed to those who need it until the supply has been gone. It's only for those people who truly need it and actually in financial straits that could use some help in that particular area. So please, if you want to swing by, we'll do it so you just open up your back window. They'll put it in the back window. You won't even have to touch anything in the process, and we'll just provide that to you with the help of the folks at the staff at the Council on Aging Human Services Center. So just want to make that information available to you. So please please be patient and of course at all times use social distancing in any way, shape, or form that is necessary while that's being done. And at 11:30 today, the Board of Health is having a meeting to actually provide further authority to the Board of Health Director during this time, so that they don't have to meet on a regular basis to provide her emergency authority to make decisions in the field, given certain number of situations that we have that have to be enforced by the Board of Health in this environment. Board of Health is lead agency in many cases dealing with the COVID-19 enforcement activities. A lot of the actions that have been taken by the governor's office to restrict activities in and around the city and towns throughout Massachusetts are actually being enforced by the Board of Health with the assistance of the police department in many cases. So that authority is going to be given to Pauline Zadell this afternoon, so she can do that on a regular basis throughout the course of the COVID-19 situation. I just received a note from an individual say that there were still people gathering at the parks and recreation, at the closed parks and recreation centers. Please take note of the fact that those areas are closed. That folks can certainly walk around the area and ski as long as they can maintain social distancing, but they shouldn't be gathering in those areas. Obviously, any kind of situation where folks are gathering and causing a closer than required 6-foot radius is certainly a situation where it can cause some danger to the community. So we want to keep our distance, particularly this week. This is going to be the difficult week. I think this is where we're going to see some of the cases start to peak. I know that's going to be peaking in other parts of the country, particularly New York, but in this part of the country too, in Massachusetts. Massachusetts is listed as one of the 4th largest impacted states in the Commonwealth, in the country right now, rather, and that behind Washington State, New York State, and Louisiana, and then Massachusetts. So be mindful of that we are impacted rather significantly here, and we're doing the best we can to make sure that folks stay safe as we make our way through this extraordinary situation and time. It is a good day today, and there is a great day to get outside, but certainly and walk in your neighborhood if you want. Take walks on the street, but don't be in walking through the woods or walking through the state forest. Might be a good situation too, but don't be gathering in areas. We're going to try and limit that type of activity if we can. All right, so just want to say thank you for joining me again here today. I will be back with you tomorrow morning with the latest information that I have on the COVID-19 impact here in Foxboro. Hope that you all continue to stay healthy, stay well, and you're doing a great job of not impacting the numbers. It's good to see that the numbers are staying pretty steady at this point in time. So everybody's doing their part. If we all do our part, we'll all stay healthy. So continue to do that, and I'll see you next time at 10 o'clock tomorrow morning with the latest update. Until then, stay healthy, stay well.